Good morning. My name is Dr. Mark Hernandez, and I serve as the Medical Director of Public Health Alliances at Ascension Seton. It is quite today to welcome you to what I know is going to be an informative discussion about public health in the Latinx community, an important topic that deserves much more attention and more commitment to solutions. As we have seen from recent events in our capital, open conversations about the challenges and issues in local communities and across the country are even more critical today than ever before. We've now faced a global pandemic for nearly a year that has brought to light racial and ethnic disparities related to COVID-19. And the events that unfolded at our Capitol last week make it clear that what's needed in this country is more unity, more open conversations, and the willingness to listen to our neighbors, colleagues, friends, and family, rather than continue to be divided. There is no doubt that 2020 has been a year of extreme challenges for most of us, including the COVID-19 pandemic, social injustice, and political polarization. Each of those things have rocked our country and our world in unique ways. These extreme challenges have brought on opportunities for extreme change in much of what we do in our daily lives. And while the world we live in is changing, our mission to advocate for a compassionate and just society with our words and our actions has not. One major opportunity for change brought on by the COVID-19 pandemic is for our healthcare systems to reflect on how we are providing access to and delivering healthcare to hundreds of thousands of individuals in Central Texas and beyond. We know the COVID-19 virus continues to disproportionately impact the Latinx community. In fact, local reports from the Texas Department of State Health Services estimate that Hispanics account for 40% of coronavirus cases in our state. And more than half of the fatalities in Texas due to COVID-19 have been Hispanic individuals. And a new concern has arisen, that the COVID-19 vaccine may not be provided with easy access to minority communities. Racial, ethnic, and socioeconomic related disparities in health outcomes are not new. They have been reported for years across multiple conditions. But COVID-19 has highlighted and amplified these disparities. Ascension Seton, as one of the largest local healthcare providers, we find our responsibility to work with community leaders to identify ways to continue to keep our neighbors safe and healthy as we continue living with the virus in our local communities. There are too many community leaders to mention who are helping with the servant's heart, but I will mention one, Travis County Judge Andy Brown, who has been advocating to start vaccine distribution sooner rather than later. One example of how Ascension Seton and community partners are addressing this issue is the Dove Springs COVID-19 Vaccine Community Clinic, recently hosted as a partnership between Travis County, the Travis County Constable Precinct 4 Office, EMS, the Fire Department, Austin Public Health, Community Care, our local federally qualified health center, Central Health, Ascension Seton, and then countless volunteers, including doctors and nurses from Dell Children's, Ascension Seton, and the Dell Medical School. A true coming together to serve the hardest hit fatalities and cases in the Eastern Crescent. School staff from Pflugerville, Manor, and Del Valle ISD, and our Capital Metro workers age 65 and over were provided access to the vaccine. This effort focused on those most in need and an intentional focus on serving the most poor and most vulnerable, in keeping with Ascension's mission. The inequities and disparities seen from COVID-19 have brought needed attention to longstanding issues. Awareness has been critical, and we cannot help but to have this data inspire demand in the ways that we connect and support each other. I am very grateful for Leadership Austin's commitment to discussing real issues faced by many in our community, and for hosting this discussion today, as well as the many other pertinent conversations throughout the pandemic. I hope that it will shed light on additional opportunities for our local healthcare systems to continue to expand access to healthcare to all individuals in Central Texas, and that each of you raises your voice in solidarity to ensure a more perfect union and a more just community. Thank you.
Good morning. I'm Courtney Bailey, Director of Issues and Engagement at Leadership Austin, and I want to thank Dr. Mark Hernandez of Extension Seton for those thoughtful and timely words. And I also want to thank you all for joining us for this important conversation on public health and the Latinx and Hispanic community. Before we begin our program, we thought it was important to take a minute to collectively address a dark moment in US history that we all witnessed last week. It was heartbreaking. It was also a horrific sight to watch as a hate-filled mob stormed the Capitol building, the altar of our democracy. Though we are a nation divided, lawlessness and violence is not the way we settle differences in a democracy. Inclusive leadership matters, personal responsibility matters, character matters. These are certainly values we see reflected in the current leadership that the current and future leaders that we train through Leadership Austin programs. And we want to thank you for caring about our community issues, learning about them, and seeking out opportunities to work together to resolve these issues through programs like Engage. Leadership Austin has been partnering with Austin PBS on these vital conversations for the past 4 years, and it is a pleasure to be co-moderating this topic with Judy Maggio.
Thank you, Courtney. Good morning, everyone. We thank you for sharing part of your morning with us and for taking the time to engage with us on this very vital community impact of COVID on the Hispanic and Latinx communities, that they really have been profoundly impacted by this pandemic. So we appreciate you taking the time to talk about it. And we want you to engage with us. Please text in your questions, and Courtney and I will get to those if possible. You can do that by simply typing in what you want to ask right there in that comment section. Courtney.
Thank you, Judy. So I want to introduce our panelists to you all. So first we have Dr. Kimberly Avila Edwards. She's a pediatrician at Dell Children's Medical Center, and she's also part of Extension Seton. We also have Dr. Marisol McDaniel. She's a postdoctoral research fellow at University of Texas Latino Research Institute. And lastly, we have Dr. Rosa Maria Murillo. She's the Chief Executive Officer at El Buen Samaritano. So thank you all for joining us today. And so I have the pleasure of asking our first question, and this is for everyone. So the Latinx and Hispanic population makes up about 40% of the state's population, but it accounts for 53% of COVID-19 deaths. From your perspective, how is this disparity harming the future of the Latinx and Hispanic community in our greater Austin region? And what does this say about public health in our region? And I'll start with Dr. Edwards.
Thank you so much, Courtney and Judy, for the opportunity to be here today. It's such an honor. When I think about the COVID-19 pandemic, it really has exposed the disproportionate pre-existing frailty and vulnerability to poor health outcomes that has existed for generations of key population groups, including Austin's Latinx communities. These statistics that you mentioned, Courtney, really highlight the heightened adverse effects of COVID-19 pandemic on vulnerable populations being seen throughout the United States. As a pediatrician, what I would say is that the disparity is harming our future generations of the Latinx community in our region, because SARS-CoV-2, the virus that causes COVID-19, is directly affecting our Latinx children. The American Academy of Pediatrics and the United States Children's Hospital Association are collaborating to collect and share all publicly available data from states on child COVID-19 cases. And as of January 7th, nearly 2.3 million children have tested positive for COVID-19 since the onset of the pandemic. In August, the CDC released a report that revealed that Hispanic, Latinx, and non-Hispanic Black children had higher cumulative rates of COVID-19 associated hospitalizations than did non-Hispanic white children. The rates among Hispanic and Black children were nearly 8 and 5 times respectively the rate seen in white children. So the point I want to emphasize is that the highest rate of COVID-19 associated hospitalization is among Hispanic, Latinx children that look like me, and 40% of our state population. When I think of public health and the response, really in order for public health to address the emerging and disparate impact of COVID-19 on the Latinx community, it's critical to harness known evidence-based health equity promoting strategies and to apply these along the full COVID-19 care continuum from prevention, including vaccination and testing, to treatment and care. And along with these strategies, we have to have an intensified and sustained effort to dismantle longstanding social determinants of health. And by that, I mean income, employment, housing, education, and physical and social environments that have provided fertile ground for the COVID-19 pandemic's devastating impact on populations long vulnerable to significant health disparities, including the Latinx community.
Next, I'll go with Dr. McDaniel.
So I think that a lot of, as far as it really affecting the Latino population, I think it's because of the essential workers. People, I heard a quote last week, and I don't know exactly who said it, but it was like, Latinos are the backbone of the country. We help the country move forward, but they're completely being neglected during this COVID-19 pandemic. But when I look more in the numbers themselves, when I think of future generations in the Latino population, we're seeing like a difference in the age group. So we're seeing the children being more affected, as well as individuals in that 35 to 44-year-old. So people who have children right now are dying at a lot higher rate amongst Latinos. So almost half of Americans that have passed away due to COVID-19, 35 to 44, were Latino, versus 27.3% for Black and 15.5% for our white populations. So just taking that into consideration, the lasting effects of children who are growing up without parents, or children who are having to live in multi-family situations because their parents have passed away, or their uncles and aunts. We have to take that into consideration as well as we're thinking about how the lasting effects of COVID will turn out.
Thank you, Dr. McDaniel. Dr. Murillo, you're on the ground. So can you speak to some of those numbers that you heard from Dr. Edwards and Dr. McDaniel from El Buen Samaritano? You're muted.
Thank you so much. And so to the question of how this disparity is harming the future Latinos, let me just be clear that systems in place were harming Latinos way before COVID. Systems in place have contributed to the disparities that my colleagues have shared with you. And so COVID, as Dr. Avila and McDaniels have said, is just highlighting that more. How do you harm community? In three ways. You take their ability to have food, you take their ability to have shelter, and you take away their sense of safety. And right now, Latino children and families have those three things taken away from them. And if they haven't, they're struggling to maintain them. Every day we hear stories about unimaginable experiences from our families we serve around food, shelter, and safety. Those three things harm all of us. When anyone here has no ability for that, we are traumatized. So think about the trauma that children are experiencing right now through hunger, shelter, lack of shelter, and safety. Isolation. So those four things combined are harming the future. But let's be clear that the future of our country was already being harmed before COVID. And I am unapologetic about calling that in this discussion, because for me at the ground level, I see and I am challenged to work with partners at all levels, at healthcare, public health, social services, so that we do what public health knows how to do best, and that is bring collaborators, bring resources, because that not one entity can make it all happen. It'll take all of us. And one of my favorite soapboxes here, when Latino children are harmed, we are all harmed. This nation depends on Latino children to continue being an amazing nation. That sounded like a soapbox.
No.
But that's
And you're speaking from your heart. That's important. And I think what you said, Dr. Murillo, about the pandemic magnifying so many of the disparities that already existed in our community is so very true. And we're seeing it again with the rollout of the vaccine. And that's what I want to talk to all three of you about.
Yes.
I know that Austin Public Health took some steps this week to try to expand the reach of the rollout of the vaccine. But last week, there was a news release from the Austin Latino Coalition, and more than 17,000 people at that time in Travis County had received the first doses of the vaccine. But there wasn't a lot of information about demographics other than age, like who's getting this vaccine. So what are your thoughts on the current rollout of the vaccine? I'd love for all three of you to weigh in on that. Dr. Edwards, would you begin?
Sure. Thank you for that question. So I recognize the concerns the community of color will have trouble accessing vaccinations because of where vaccine sites are located, and we have to acknowledge these inequities. In addition, I recognize adding demographics would best be resolved at the federal or state level to ensure systemic equity and comparison across states and across the country. However, having just participated in the Travis County's first drive-through COVID-19 vaccine clinic that Dr. Hernandez mentioned, I can say that so many in our community are working and committed to equitably distribute vaccines, especially to the communities and people hardest hit by COVID-19. And along with Dr. Hernandez, I do want to take this opportunity to thank Travis County Judge Andy Brown, because it was a servant leadership who called us to respond and to serve our most vulnerable in the community. It was an amazing collaboration that you mentioned, Dr. Murillo, that is going to be necessary. I saw individuals with different titles, organizations come together because we want to protect our community. And I know that over the next few months, I'm confident that there will be more calls to action to help our community. We all have a responsibility to work with community leaders to identify the ways to continue to keep our neighborhoods safe and healthy, and to provide that shot of hope to the most vulnerable individuals in our community. As a physician, I know we have to overcome barriers to vaccination in the Latin community, including vaccine hesitancy. As a provider, I recognize a barrier to vaccination among the Hispanic community includes hesitancy over the vaccines due to the rapid development, the approval of vaccines, the history of medical racism, and question over the vaccine contents. As a pediatrician, vaccine hesitancy is something that I deal with on a daily basis. But as a Latina, born and raised in El Paso, Texas, first-generation American and a physician, I feel a particular sense of engagement and responsibility to dispel vaccine distress among the Latinx community. I share very openly that I have now received both Pfizer doses of the COVID-19 vaccine, and because of their ages and underlying medical conditions, just last week, both my parents received their first Moderna COVID-19 vaccine from their primary care physician. I share with my patients, with their families, with members of the Latinx community, and now I share with each of you that I would not recommend anything for you and your families that I do not recommend for myself and my own family.
Dr. Maria, are you seeing this vaccine distress among the people that you serve at El Buen Samaritano?
So I love that question. Just last week, we did a flash assessment through our drive-through pantry. During our drive-through pantry, we see anywhere from 150 to 200 families per day. And we interviewed 126 individuals to ask them, have you heard about the vaccine? Would you take it? And if you don't want to take it, why not? And 40% of the folks that we talked to said they would not take it. All right. And the themes that we heard across was because there's not enough information, because there's inconsistency information, because we don't know where to get the information, issues of trust, over and over again, nothing you don't already know. Lots of fear about the reaction. If I take it, what's going to happen to me? I've heard people can get brain damage. I've heard people can go blind. I heard people can die. And so fear about what reaction is out there. And then lots of questions about where. Okay, I want to take it because one of the questions was, is there anything else that you want to know? And they wanted to know, where can they go? Where can they go? And I think that my prayers and hats off to the public system that is attempting to get this out there. Important that we have a coordinated outreach and marketing approach so that people are constantly hearing, okay, this is where we are now. This is where you can go. This is how you can go. Using multiple ways. We can use a website, we can use social media, we can use person to person through pantry services, because right now that's kind of about the only way, pantry services or in-person health services, that we can be talking to people about the correct information. And I was asked, would you take it? And I said, yes, I would take it.
And I think being a role model like that really does help. You're setting the example. Dr. McDaniel, let's talk from your perspective about the rollout of the vaccine and also this issue of trust and how you build that and make sure that you set those examples for people in the Latinx community.
So as far as really getting reliable information out, disseminated in English and Espanol, and make sure that the leaders are involved with the dissemination of the vaccine. They have to be advocates for the vaccination to get past skepticism, hesitancy, disinformation about certain side effects. I've heard about memes on Facebook that are circulating. They're funny, but people are seeing them and people are starting to take them a little bit seriously, especially when you're constantly seeing memes of supposed reactions to the vaccine. And I think that as far as trust, just having those leaders involved is imperative on establishing trust in the many Latino communities here in Austin, and as well as really getting on the ground. I understand that's hard because of COVID to be around people. So food pantry, I know that there are still certain PPE drives going on around Austin and Central Texas, as well as other drives. I know that during the holidays there were some, but we weren't able to capture any vaccine information. But I think as far as the rollout itself, I heard that HEB has a registration portal that's about to go live soon as they get their new vaccines. Walmart, going to wellness centers, local pharmacies, and having them involved as the beacon in the community to get the vaccine, I think is also a way to build trust in the community.
May I add something that I see as a critical component of marketing, outreach, and information, is that at one point is my hope that we will get to mass vaccination, right? And so what are we doing right now with all of our collaborators to ready our community assets to do mass vaccination? We got to start having that conversation 3 weeks ago. Maybe those of you in the healthcare probably have started it, but at the community level, we have got to start talking about how we're going to organize ourselves. Should we have the opportunity to get to a mass vaccination situation? Because right now, the numbers of vaccines are relatively low to what needs to be done.
Thank you all for that. And so in the audience, we did have some questions, but you all answered those. So there were questions about cultural mistrust and the Latinx and Hispanic community being targeted. And so I appreciate you going through that to get to those answers. So my next question is for Dr. McDaniel. As a researcher, what national and state data stands out the most in regards to the impact of COVID-19 in the Hispanic and Latinx population? I know you touched on that earlier, but can you share more info?
Yes, I have a few more stats to share with you all. So I know that we've talked about Latinos being 3 times more likely to become infected with the virus, nearly 5 times more likely to be hospitalized than non-Hispanic white. These are CDC numbers. Latinos have the greatest share of deaths in age groups under 54, according to CDC. And again, looking at that breakdown that I mentioned before, about half of Americans 35 to 44, half of those individuals were Latino, compared to 27.3% of Black and 15.5% among the white population. But think of that in contrast to this other number of like those, I guess when COVID first hit, it was mostly older individuals, so 65 to 74 age group. We're seeing that 45.3% killed by COVID-19 were white versus 24.7% amongst Blacks and 23.1% amongst Latinos. So this is not, in the Latino population, in the community, this is a disease that is affecting our younger generations, not our older generations. And I know that that information has been shared a lot, that it's still going towards the older, but we need to take a step back and see in the numbers that that is not the case. Individuals that are parents are being affected the most. Thinking back, I guess, on more of past COVID-19 and this, well, sometimes I hear a secondary pandemic of mental health, toxic stress because of the pandemic, being lonely, being isolated, as well as the racial and social inequities that have been magnified during the pandemic, have huge implications for physical and mental health and socioeconomic outcomes as we move forward. The toxic stress can also be due to losing your job, losing your business, your people in your family losing their businesses. And one stat that I saw, and this is the last stat I'm going to present right now, is 40% of Latinos nationwide reported frequent symptoms of anxiety or depressive disorder, according to analysis from April 23rd to November 9th. So I think about a big chunk of the year. And this is data that was collected by the National Center for Health Statistics. So almost half of us are experiencing symptoms of anxiety and depression. And what does that mean for our community?
I'd like to build on that a little bit and talk more about mental health in general, because we know that the pandemic has made that so much worse. And there was already a bit of a stigma in communities of color about dealing with mental health issues. So how can we overcome? This is again an issue kind of trust and destigmatizing an issue like mental health, because everybody knows that we all need to reach out if we're suffering from anxiety to depression, and these things have gotten so much worse during COVID. Who else would like to build on what Dr. McDaniel started talking about with the mental health issues?
I'm happy to contribute, Judy. As a pediatrician, even pre-pandemic, I was acutely aware of the rise of behavioral health issues in children. I've been a pediatrician in our community for 20 years, and the clinical magnitude of the issue of mental health has been striking. I think the way we can overcome mental health is to not be afraid of asking and discussing mental health illnesses. As a pediatrician, it's standard in my practice to ask every pre-adolescent and teenager who come in for their well-child checks about mental health system and any point in between their well-child checks. This has to become the norm. I believe we have to have these culturally appropriate conversations in our community members' primary language about mental health, as well as provide culturally competent mental health resources.
And Dr. Murillo, this must be an issue with the immigrant community. There are already so many stresses involved in coming to a new country, and you're dealing with a lot of these immigrant families. Talk about the mental health aspects of that.
Exactly, right? So going back to no access to food, isolation, and shelter, but that toxic stress that Dr. McDaniels is talking about. We see it every day. And we talk about doing culturally competency practices and approaches, right? And we start by saying, ¿Cómo está? How are you? We don't approach people with, let me talk about mental health issues with you, because of the stigma already there. Like, no estamos locos is a common saying in Latinos. My mother even says it, no estoy loca. And so it's about, how are you? And that question opens up an opportunity. When people are trusting us and we ask the question, how are you? You'd be surprised what information we gather that allows us to create pathways with them to resources that can address a child having anxiety, a mother having ansiedad, whatever it is that they're having. They discuss it with us in a dialogue, not in a structured mental health environment. And one of the things for us right now with the pantry, we have a lot of opportunities to ask, ¿Cómo está? How are you? What else can we support you with? That's one way that I would pose to our colleagues and our friends listening, to start that dialogue without even saying mental health. And not that mental health is a bad word.
Thank you, Dr. Murillo. So I'm gonna go back to the pantry. So about 9 months, you all started working as an emergency food pantry. What percentage of your clients face food insecurity, and what community strategies would you like to see to address hunger issues among Hispanic and Latinx families?
Right. So 9 months ago feels like 100 years ago now for us. And I'm going to give you 3 numbers. 2 days, 4 times, 20,000. Back in March 17, in a matter of 2 days, we set up El Buen Samaritano Food Pantry as an emergency response operations entity for food access in 2 days. And within 2 days, we had scaled up our capacity to serve 4 times the number of families that we had been serving. We also established, to your question, partnerships with other nonprofits that would allow us to extend our reach for those families that could not come to our pantry. By the end of 2020, we had received 20,000 visits to our pantry. So to your question of like, what is the need, clients suffering from food, it is huge. And what we're seeing right now is it's probably not going to get any better over the next 4 or 5 months. We'll continue to see that need. El Buen is one of the largest pantries in South Austin and into Southeast. There are pantries. However, in terms of the capacity, we're one of the larger pantries in this side of a town, and we serve all zip codes. So people from Pflugerville, everywhere, all the zip codes are coming to El Buen Samaritano. Colony Park, Del Valle, you name it. And so it is quite a need. The other 2 areas that we're seeing increasing is seniors, older adults. And we have established a partnership where we're providing additional meals for seniors that cannot come. And then also for AISD students on Tuesdays. That's a huge need. One of the stories that we keep hearing is not a story, but experiences from the families that come with the students is that they're not getting their food stamps on time. So even with the pantry food that we provide to them, they need additional food. So they come on site for food for their students.
Thank you, Dr. Maria.
Dr. Edwards, could we talk a little bit more about something you touched on, something everybody's touched on? This is the disparities when it comes to children, because that really touched me. And I want to know more about it, because I remember there was a recent story from KXAN that said, you know, out of all the children admitted at Dell, 10% required ICU care, and the majority of those were Latinx kids. So what collaborations can we think about? What do you want the community to know about this? I just think it's a huge issue that really needs addressing.
I cannot agree with you more. And I wanted to provide some updated statistics from when that story was aired. So over the last few weeks, we've seen an increase in the number of cases of COVID-19 in the pediatric patients. But we are now at about 4.5% of patients who are admitted for COVID-19 that need intensive care in the pediatric intensive care unit. But what is so striking is we are continuing to see, and the most recent statistic I got as of yesterday was 87.5. So nearly 90% of those admitted to the pediatric intensive care unit at Dell Children's Medical Center are Hispanic. And the data in that is not unusual when compared across the nation. Nationally, a third of children hospitalized with COVID-19 are admitted to the ICU. And I do want to take a moment to remind everyone that the case fatality rate among children remains low. And I think that is something I definitely want to stress. But even among children hospitalized with more severe forms of COVID-19 complications, like the multisystem inflammatory syndromes of children, which is really a condition where different parts of the body can become inflamed, including the heart, the lungs, the kidney, the brain, the skin. We see more in the Hispanic community. You know, I mentioned earlier that the likelihood of a Hispanic child needing hospitalization is 8 times that of white children. And the CDC also reported that there are higher rates of the multisystem inflammatory syndrome, or MISC, which is what it's known by in these populations. Nationally, more than 3/4 of these reported cases have occurred in Hispanic or Black non-Hispanic children, and specifically Latinos account for about 42% of them. So and you know, I think that the key statement that we've all made is that children are 100% of our future, and we are seeing long-term cardiac effects on them. So addressing this disparity is so important. What is so interesting from that CDC report is that we found about 42% of the children who are being hospitalized have a pre-existing comorbidity. And the most common one is obesity, which again, highlighting that COVID-19 is just magnifying and putting the spotlight on disparities that pre-existed. We all know that 1 in 5 children suffers from childhood overweight or obesity, and the majority of them are in Hispanic and African-American children. So there seems to be a link between that comorbid condition and more severe COVID-19 clinical courses. In terms of responding to this disparity, you know, part of the mission of Dell Children's Medical Center Ascension is to serve all persons with a special attention to those who are vulnerable and those experiencing poverty. Rooted in our mission, I have practiced general pediatrics since I joined Dell Children's on board the Children's Health Express, which is Dell Children's mobile clinic. And our mobile clinic provides comprehensive medical care and services as the primary medical home for uninsured children. We provide wraparound services. So Dr. Murillo, partnering together with you, with your food bank, these are the ways to address those social determinants of health needs, including behavioral health services. You know, our healthcare ministry has responded to the needs of the community since the beginning of the pandemic by providing access for our community, especially the Latinx community, to virtual care, to a 24/7 COVID-19 hotline, to online resources and information. And now we're committed to COVID-19 vaccine distribution efforts. You know, as of yesterday, our Ascension, Texas ministry has administered more than 55,000 first dose COVID-19 vaccines and more than 9,000 second dose vaccinations. And again, I think the drive through COVID-19 vaccine clinic that we participated in last Saturday is just the beginning of these collaborative opportunities. Our pediatricians have dealt with COVID-19, but not to the extent of our adult colleagues. And I can tell you, within less than 24 hours, I had over 50 pediatric associates and colleagues who had signed up to administer vaccines, because we are ready and willing to collaborate and to be there on the grounds providing the services that our community needs.
Dr. Davila, we have an amazing parking lot at El Buen. We gotta talk.
Yes, ma'am.
And by the way, I grew up in El Paso too.
We're getting the collaborations right here on Boston Engaged. That's great. That's great.
I want to read a statement from the comments from Gloria Vera Bodoya. I think I probably said it wrong. I'm sorry, Gloria. The city of Boston needs to make authentic efforts in their brown citizens. Stop gatekeeping Latinos by limiting their access to resources. Can any of you speak to the dangers of gatekeeping when it comes to access to resources?
Oh my God, should I be the first one to even dare? I mean, our systems are based on a framework of gatekeeping, on a framework of lack of trust of communities, systems that look at communities as if they don't know what is best for them. So, I mean, we could have a whole 3 hours just on that. I think that, at least from El Buen's perspective, what we do to take that on is constantly communicate, advocate, educate, and mobilize the people, the families that we're serving, but also the partners that we're bringing along with us, right? We don't believe in the very little, and by the way, it is not little resources. This is a nation that is full of resources. It is how we allocate those resources that has placed us in this situation. So whatever resources we know are out there, you know, and we will partner with you at whatever level to go after those resources and to call a gatekeeper when we see a gatekeeper. And having said that, think about a system that is created for nonprofits. I happen to be in a nonprofit right now. I have worked in public health forever, but a system that puts nonprofits to compete against each other for resources that are being, selectively allocated. That system does not make us a powerful community. And so I'm, Ms. Bedoya, I'm probably, I'm right there with you. And I probably didn't say anything that you didn't already know. I like sharing this because that is a framework that we use as we go after resources for the community that we're serving.
We talked a little bit about this, but I'd kind of like to expand on it because I think it's so front and center right now, the rollout of the vaccine being so recent. This is coming from Shelley Gupta. And the question is, what do you do for those who don't trust the health authorities? What are the best avenues for building that trust? And I know that Dr. Maria, you talked a little bit about just saying, how are you? And when somebody comes through the food pantry to talk about some of these other medical issues. But I was wondering if Dr. McDaniel and Dr. Edwards could possibly build on that a little bit more and talk about ways that you can gain that trust from people who might not necessarily be comfortable in the healthcare system.
I think promotoras, navigators, of course, are basically the best system here in Austin to getting information out, and again instilling that, trying to build the trust for health authorities or for health programs, health centers. But it's also really just being seen. So I think if health authorities were more seen in the community, they're actually there at the food pantry, they're actually there at the PPE drives, then I think seeing people and knowing people, oh, that's Dr. So-and-so, and they're working with the vaccine rollout. Oh, and they come up to you and ask you how you're doing. I think just seeing people in the community makes a huge difference, as well as, again, making sure that the disinformation is being taken off of everything, and really the whole community has to build themselves up in order to be open to the vaccine. So I mean, it's on the health authorities. It's their responsibility as well as the community. So talking to your family and friends about the importance of the vaccine. So for COVID, I've heard from different nurses, well, yeah, COVID is dangerous. Yeah, it could be scary to get a vaccine. It's scary to get a shot, but it's even scarier to get COVID. So just really, again, being as transparent as possible and being in the community.
You
I
mentioned.
agree with you.
Oh, go ahead. Go ahead.
I was going to say,
Dr.
I can't agree with you more, Dr. McDaniel. And what I want to highlight is promotoras, or asking, how are you doing? The fundamental piece of that is relationship building. Who do members of our community have relationship with? Was it somebody who is in the healthcare field who may look like them, who can say, no estés nerviosa, todo va a estar bien? Where are those key relationships? I can't tell you on Saturday how many individuals that I saw in their cars who had so many questions, taking the moment to build the relationship, to answer the question, to honestly, to your point, Dr. McDaniel, to honestly and transparently say, gosh, after my second dose, I did run a little fever. I did feel achy. Even my teeth hurt, but that's a good thing because it tells you your body is doing what it should do. And I love our ministry because nationally, Ascension National has been looking at many of the social media sites to understand what the needs of the Hispanic or African American community are in terms of the gaps with vaccine acceptance. And key there is listening to where the concern is and finding those key members of our community. It may be promotoras, it could be members of our health care system, it could be faith leaders, it can be members of the legislature who look like members of our community who feel disenfranchised, to see them get their vaccines, to know honestly and transparently how they felt. I think, again, cannot emphasize and agree with you more, Dr. McDaniel, that we have to all be upfront and honest and take the moments to answer questions as thoroughly and completely as we can.
I love that. And, that makes me think about, so the trust piece, right? The organizations that have been in this community that have earned the trust, not over the last 2-3 weeks or 9 months, but there are key organizations in this community and key groups that have 100% trust of the community. I get chills thinking about that. What are we doing to work with those key entities that already have that trust? Because the lack of trust that is happening right now is 100 years, 500 years in the making, right? And so it's not going to change overnight if somebody that is not usually out there shows up, right? But if the groups and the individuals that have been out there continue to show up, I'm probably being a broken record, forgive me. If we're showing up and saying, here it is, here's the information, I'm willing to do it. ¿Qué pasó? ¿Cómo le podemos ayudar? Consider it. I think that we can make a dent in that question about how do we make vaccines a priority in light of trust, but also in light of looking at this in light of people not having access to food or shelter.
Thank you, Dr. Murillo. I do have a question. So not everybody may be familiar with promotoros or community health workers, right? So can one of you speak to, any of you speak to the importance of community health workers and whether you think we have a shortage of them, and how can we build more incentive to create more community health workers or people who are from the community providing these services.
Yeah. I'd be glad to start, and then you all chime in. Community health workers have been around for hundreds of years, going back to barefoot doctors, going back to Latino America, going back to many communities where just community individuals saw the need for their neighbors to have healthy well-being in their lives, and people that raise their hands to say, hey, here's some resources, have you thought about this? So they've been around for quite a long time. In the United States, going back to the 1950s. So not to give you a history lecture here, but they are members. They are members from the community that are connected to the resources, that are trusted by the community, right? So si la señora, if Mrs. Torres shows up, they know, they trust Mrs. Torres. So if Mrs. Torres is saying, please, here's some resources, or please come with me, or I'll take you, or here's the information, people will trust. So that's a key element of community health workers. They can work in healthcare, they can work in social services, in education, in whatever sector. They are an essential workforce of that sector, because in many ways, they are like the link, the bridge, right, between community and the resources and the services. But the key component, from my perspective, is the trust that they have. That's powerful, right? If you have trust from the community, that is powerful. And they know how to use that to help people navigate through systems that are often unfriendly for them.
Thank you for that. I think the theme that we're hearing is trust, breaking down the cultural mistrust. So I appreciate that. Would anyone else like to add anything before we go into our call to action?
Well, then let's go ahead and let's go into our call to action. It's the way we end all of the Leadership Austin Engage programs. So there's so many people out there watching, and they want to do their part. So if you could give us some ways that we can all do a better job engaging and reaching out to those in the Latinx community here, we'd be greatly appreciated of your comments. So Dr. Edwards, I'm going to start with you.
My call to action is going to be partner together. This is our community, not my community. The pandemic has made it clear that we have a responsibility to reach our friends, our families, our neighbor. And I'm going to go back to something that Dr. Murillo said that I absolutely loved, and I could not agree more, simply asking, how are you? In my clinic, it's been amazing to hear some of the stories shared in response to these words. And as a community, we're not okay. And we need to share our stories with each other. Together, we're stronger. We know our community best. We know our community best. And we must bring together our talents and resources to provide all, but especially to those who are experiencing poverty or are vulnerable.
Dr. McDaniel?
My call to action is pretty similar to yours. So it's really just the best, more mental health aspect, reaching out to people that you love, that you haven't talked to in a long time, asking how are they doing? Do they need anything? When you learn about anything in the community that's going on, make sure that you share with other people. I guess just really, again, building that community back after we've gone through so much in this last year, really just getting down to the heart of it, and making those lasting connections with people, I think is a major call to action as we move forward and heal from this pandemic.
There's a lot of healing to do. Dr. Maria.
Yeah, my call to action is, if you happen to be in a place of privilege and can make a call to a faith base, to a nonprofit, to a hospital, to an organization that right now is up front in the line of attack, and can assist them through volunteerism, through outreach, through donations, I ask you to take that step if you are in that place of privilege. There are many doctors, and Dr. Davila probably has this even much better than I could ever explain it, that are fighting this fight, putting their lives at risk. Just like there are pantry workers and frontline workers and construction workers out there. And we need your help. We need your help to keep them protected so that they can continue to fight the good fight. And I don't use the word fight, often, but this is what it feels like to be in the front line.
So we have a little bit more time, so I do want to ask a follow-up question to the call to action. So we have an audience question that's asking for you all to share who are some of those key organizations that have gained the community trust. Like, can you mention a few of those that they could start connecting with?
Yeah.
Dr. Maria, you can
Yeah. I'm probably, what happens when you start naming, right? You're going to forget somebody. So I ask forgiveness right now. There are many, all the way from very grassroots organizations to mid-level to huge organizations. Avance, who works with moms and children who have access to the families and the trust of families. Todos Juntos. GAVA, Go Austin, Vamos Austin. There's groups that work with mothers that are about to give birth. Refugee Services of Austin. I wish I had the list in front of me. LifeWorks, and I'll look to Dr. Avila and McDaniels to see if they can fill in with some organizations that I'm probably going to forget. Poder, Latino Healthcare Forum, are organizations that are at the ground level, working with community. The Austin Urban League, the Coalition for Health, grassroots organizations, and I think I'm butchering their name for the Coalition for Health group. Faith-based organizations. We're working with the Presbyterian Church in Lake Austin to reach a community in one of the wealthiest counties in this state, where you go in and it's like you've entered a third world community. So they're out there, and I would be glad to connect through email if you like other organizations.
Thank you for sharing those. Dr. McDaniel or Dr. Edwards, would you like to add to that list?
The only organization I can think of on top of my head is Con Mi Padre. That's one that I
Yes, that's right. Oh, yeah, that's right.
And I'm still thinking of a couple others.
And some of our partners have been Central Texas Food Bank, Women, Infants, and Children, our elected officials. I know I've mentioned County Judge Andy Brown a few times. But just to share who some of those partners were for Saturday, our constable of precinct for Constable Mr. Morales, elected officials, Mayor Adler, our council members, so many were so integral. Our FQHCs, Federally Qualified Health Centers, Austin Public Health, all vital community members that we've joined, maybe Boys and Girls Clubs. Just there are so many fundamental organizations in our community that support our community. And I don't think we can exclude any of them, because it's going to be an all hands on deck effort.
And I have a few other organizations, I guess, thinking more even geographically. So neighborhood associations. One I can think of that's very strong here in Austin community is the Colony Park Neighborhood Association. So really tapping into specific associations geographically that can help us, and that also have the trust of their community.
And school districts. Austin Independent School District, we partnered with them, Pflugerville, Maynard, Del Valley. Just teachers are going to be some of those trusted members of our community.
Thank you all for sharing these resources. I think there's a lot more collaboration and cross-pollination going on in our community than a lot of people realize. And I know that the Austin Latino Coalition has also been filling in a lot of those gaps when it comes to getting people protective equipment and food resources that they need. So thank you all. This has been such an enlightening conversation. You guys have given us so many wonderful nuggets of wisdom and perspective that I think we all need to better understand this issue of the impact of COVID-19 on the Latinx community. So we appreciate you, Dr. Murillo, Dr. McDaniel, and Dr. Edwards. And I do want to tell you one more thing before we say goodbye. We started out this conversation discussing the heartbreaking attack on the Capitol and how this is how we do not settle differences in a democracy with lawlessness. And there are hearings going on right now on Capitol Hill, but I wanted to let everybody know about a program that we're doing at Austin PBS. On Thursday night, January 21st at 7:30, our ATX Together program is called Finding Common Ground. And I'll be talking with 3 thought leaders who their profession is helping people find these shared values and see the humanity in one another. So we think it's going to be a very timely conversation, an important conversation, as we all look for ways right now to do our part to mend our torn country. So I just wanted to put in a little plug for our ATX Together coming up, Finding Common Ground, on Thursday night on Austin PBS, the 21st of January. Courtney.
Thank you. And I just want to tell you all, thank you for tuning in. And I want to remind you that next month we'll be talking about Black maternal health and wellness. And so we hope to see you there for that conversation. And so thank you all. Have a good morning.